Well, it came out of some work we did in advising what's called the Kennedy Commission in the UK, which was a commission that was set up to evaluate NICE, which is a body at the National Health Service in the UK, responsible for essentially technology adoption in the national health system there. And they had some issues, and our company, Precision Health Economics, the company that I'm a managing director of, was essentially consulted to evaluate some of the Kennedy Commission work that was going on. Well, the thrust of it was essentially to evaluate how what they're doing at NICE impacts innovation. They are essentially responsible for determining reimbursement policy, how much the National Health Service pays for, and under what conditions they pay for medical products in the UK. And they were set up to evaluate what effects to do what they're doing have on innovation incentives through the reimbursement process. One issue that we raised, which I think is important, is to evaluate what European countries like the UK are doing compared to the US, because the UK is about 3% of world sales for drugs, and it's very similar across other medical products given their population size, as opposed to the US, which is roughly about a half of the world market for these products. So what UK are doing, I argued, and it wasn't necessarily very popular, but what UK are doing are not affecting innovation so much, because innovation is essentially done for the world market. People in small countries don't do innovation for their own countries, they do it to sell it mainly in the US. The sales and profitability of these products come from the US. So the issue is really the European countries have a very different trade-off in setting reimbursement policy than, let's say, CMS for Medicare and Medicaid here in the US does. Because CMS policy will greatly affect innovation incentives, as opposed to NICE, which, even though influential in emerging markets and some other European countries, are at a level of world sales where the innovation incentives are not so affected. That said, there's an issue because many European countries act this way, which is to say they hold down prices or reimbursement for medical products. And in combination, when they're all doing that, that will adversely affect innovation. Europe is about 25% of the world market for medical products. And each country has a perverse incentive to control prices or to set prices or set them below market level, because they're not individually affecting any new flow of products coming into their country. Even though as a union as a whole, the European Union certainly affects innovation incentives, being roughly a quarter of the market. So that was a part of the discussion that we brought up of how to try to get European countries, in some sense, to not hurt the incentives for innovation in their combined effort as opposed to in their unilateral efforts, which is what NICE is concerned about. And we haven't constructed it yet, but it has to do somehow with a coordinated effort where we get away from the current system where essentially they are benefiting from the market prices that are held up in the US, from the flow of innovation that comes into the world from that market into their own countries without essentially paying the market prices that could actually increase that flow of products. But I think it's a very difficult issue to implement, particularly in an austerity environment where you're trying to cut public budgets. But it is clear that were US to adopt similar policies as NICE in the UK, there would be dramatically different effects on welfare of patients than if NICE does it alone. I'm not very optimistic given the budget problems they have. I mean, every country, including the US, is looking for any ways to limit spending, and in that inclusion goes medical products. Even though medical products, or for drugs, for example, are only about 11 or 12% of total spending, they get a lot of focus in terms of the public discussion, and a natural tendency, political tendency, has been to try to limit those prices or reduce those prices in the name of healthcare costs. I think that's a little misleading, because a lot of study, including some that we have done, has essentially shown that overall spending many times gets reduced by using medical products because you avoid more costly spending such as hospital care and physician care. Well, I think that there's a difficulty in basically providing reimbursement incentives in the public sector for innovation that is breakthrough innovation as opposed to sort of marginal innovations. And in the current environment, it's very, very few governments that are interested in paying manufacturers more. But on the other hand, I think it causes great damage to patients if we don't try to keep the existing incentives that have given a lot of promotion in health the last 30, 40 years in place. There will be a very detrimental effect on both European and the US.